the beauty of it, you don't have to be sick to see a chiropractor. You don't have to,
Yeah.
you don't have to need a root canal to go see a dentist, right?
Yeah.
Just go see one before you need a root canal. Just get your adjustment,
Yeah.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Ivan Sanchez here of Back to Life Chiropractic, which is located in Steilacoom, Washington, and serves in the greater Tacoma area. He graduated from Palmer Chiropractic College in 2017 and has additionally trained in a wide variety of disciplines, from neurology treatment to sclerosis to hypnotherapy and Eastern medicine. He has an interest in relieving pain and restoring function as it relates to the neuromusculoskeletal system. He does this through adjustments, class 4 laser therapy, traction, exercise, body work, breath work, postural exercises, nutrition, and hypnosis for pain management and lifestyle changes when needed. He continues to serve his country as a combat medic in the National Guard. So welcome, Dr. Ivan. Glad to have you here on the show.
Daniel, glad to be here. Thank you. Yeah,
excellent. So Dr. Ivan, let's get right into it. I'm curious, how did you get interested in chiropractic care?
Okay, so it's interesting because I took a college career exam a long time ago, right? And it said it'd be a good chiropractor. So that actually piqued my interest, but I really didn't know much about the field or the industry. I did go medical for a long time though. And when I was in the Army full-time a few years ago, more than a decade ago actually, I had a back injury, and that actually gave me my first exposure to chiropractic treatment. And I went from not being able to walk to being able to walk, you know.
Oh, wow.
So I saw the beauty of it, learned more about it, had great exposure to it. And that kind of reignited my interest in chiropractic. And so as I transitioned out of full-time military duty, I went to chiropractic school, finished my pre-med while on active duty. And a month after I got released, I went to chiropractic college. So
oh, wow.
It's been a good ride so far.
Mm-hmm.
And I noticed you mentioned Eastern medicine, hypnotherapy. Just to let you know how that all comes together. Chiropractic is pretty much the practice of being the drugless, non-surgical doctor. And so, well, how do you work on patients that way, right? In a Western model concept. And so Eastern medicine kind of taught me the herbs and nutrition that we can use, and some lifestyle changes. And hypnotherapy came about because, and I thought it would just be one class. I had to actually do the whole program down at Palo Alto Hypnotherapy Institute in California, and for pain management. But I did the whole program, and I ended up finding that it was very effective for patients that need it. I don't throw that out there as a first go-to for my patients, but I have some interesting stories of when I was able to incorporate it that made a big difference, because certainly how we talk to ourselves and things that we tell ourselves about our environment make a big difference on our health overall, and even how we perceive pain and feel pain, you know.
Mm-hmm. Got it. Now, you talked about a couple of different treatments that you have your background in. So what would you say are some of the most popular treatments that your patients come to you for, and why do you think they're the most popular ones?
Within chiropractic, the treatments I do are pretty standardized with adjustments. Now, there's a wide variety of adjustment techniques. There's a very soft approach, which is called the occipital technique. There's another softer version, which people know as the instrument-assisted adjusting, which can be used with an impulse gun or an activator or something called arthrostem. I actually have all three mechanical devices to do the adjustments. I find that patients tend to have a preference with either or depending on their body type. But for my hypermobile patients, they seem to gravitate to that versus manual adjustments, because with hypermobile patients, they have such a strong range of motion, even when you get the joint to go in the direction it needs to go. Often with manual therapies and adjustments, they feel kind of sore afterwards. And yet I can get the same benefit using instrument-assisted adjustment without them having any pain.
Mm-hmm.
That being said, you get a big burly guy or someone that's kind of overweight. A lot of times I don't like those instrument-assisted adjustments because they say they don't feel anything, although it does its job. It does with the bone, it does it with speed, not power. And they love the more rigorous manual adjustment. Sometimes they like that crunching sound that people hear, which is really just gases getting released out of the muscle body. So I mix it up depending on the patient's needs. Class 4 laser is huge, especially for patients with neuropathy. It assists the patient in the recovery with something called photobiomodulation. Light has a very positive benefit on the cells, with increase of oxygen to the area, vasodilation, increase in the body's own painkiller production, and the decrease decrease of inflammation in those areas. The cells actually react positively and increase more energy production, which is the opposite of what they do often when they're in a state of decline or inflammation,
Okay.
So yeah, that's huge. And then traction too. I use mechanical traction on the tables, and I apply soft tissue work and laser with that. I like using laser with mechanical traction because I spread the joints across, open them up in the spine just a little bit, not a lot. The patient feels a nice, good stretch, right? If they have a lot of pain and compression on the disc of the spine or compression on the nerve root that's in between the vertebrae of the spine, that stretch helps relieve some of that tension and pressure. This is opened up externally. I point the laser right to the area that the patient is in pain, and I just shoot it there. I'll keep it there for whatever the protocol duration is that came from the manufacturer for the laser machine. Often I do more than one body part. Patient tells me they have a neuropathy down on their feet. Well, often if they have a low back injury and if the neuropathy started after the back injury, the problem really isn't so much just down at the feet. It's actually stemming from the nerve root that comes out of the lumbar vertebrae. So I'll target the lumbar vertebrae area where that nerve root's at, and then I'll also do another session on the same day and then target the feet as well. And I feel like and the patients get a pretty good outcome from that in terms of being able to relieve pain function. And so neuropathy varies. I mean, sometimes they feel numbness, tingling. Sometimes they feel a burning, stabbing sensation on their feet, and it's very uncomfortable. Changes their lifestyle. They can't walk the dog like they used to. They can't go for walks with their husbands or wives like they used to. Any activity that standing that involves standing up and walking is now decreased in terms of its enjoyment because of the pain.
I see.
So 100%, I love getting patients out of pain and restoring function, and that's a neurology part of it. But the patients also have a mechanical part when their body's just out of alignment due to injury or lifestyle. Nowadays, a lot of us have something called what they used to call military neck in the old days, and patients that had whiplash injuries would have it too. They get a decrease in curvature of the cervical spine. But call it tech neck nowadays. Technically, a whole generation has a whole new name for something that has been around for some people. Now it's a majority because they're on their iPhones all day like this.
Yeah.
Or they're working on laptops, which are horrible. Laptops. So, I'm 54, but I remember when laptops first came out, only a few people had them. It wasn't their go-to computer. Usually they had a desktop and they traveled with a laptop when they were on the go. And now everybody's working off a laptop as their main computer. And it's almost impossible to get good ergonomics on a laptop.
Yeah.
Just puts the body, we weren't meant to be in this position 8 hours a day. And I talk to some of these guys, they're 8 hours a day this way, and then they get home and now it's another 4 hours watching TikTok, Facebook, Instagram, Netflix, Hulu, video games, whatever, it changes the body. We're meant to be outdoors doing stuff, working, climbing trees as kids, whatever the case may be. If I can share this, there was a video I saw about gamers, and what they showed was guys that had been wearing the earphones on for gaming too long. A lot of people thought they got the depression on the skull right here, the muscle and all that. That's obviously can't be good. That's something we see. But what people aren't seeing is how they're changing their neck right here. And they can see it in their posture when they turn sideways. They'll often have a forward head tilt. And so, wow, that causes all kinds of issues because what affects the neck affects the low back. And so when they come in and they have neck pain, I end up working on both areas. And sometimes it's just low back. I end up working on the neck because what affects the top affects the bottom and vice versa. Unfortunately, they can't see the damage, And I'll tell you, it's kind of scary. I was talking to an audiologist years ago. And they told me one of the interesting changes that they noticed in patients was young patients were having ear damage from gaming all the time. And they were actually setting a trend for hearing aids to be more fashionable. They were wearing them with pride. Guys were playing whatever Call of Duty or whatever video game it was that they're playing. I don't want to single out that video game. It's a fun game, okay? I want to single it out. But everything in moderation, right? But they're now having ear damage. And so that was like their combat badge of honor as a kid. Yeah. That's how they were looking at it. But with gaming or with excess computer time, the neck changes its curve. So it goes from having what would be like a C curve in this direction to being very straight in that direction. And there's a problem with that. So biomechanically, when you have the curve in your neck and then your upper back and the low back, it's an S curve. The spine works as a spring. When you walk, it accepts gravity and cushions and buffers between the disc and the vertebrae. But when it's straight like that, it becomes 7 times weaker. And then instead of working like a spring, it works like a nail. And so those compressive forces go against the disc and the nerve, and they do more damage than good, obviously. Instead of working like a spring where it can go back up and kind of do a flexion contraction, it's just a straight drive down. And so people come home from work, a lot of neck pain, pain between the shoulder blades, pain between the low back.
Okay.
And
I think that's a great way that you explain it, because I think a lot of people don't really understand like how the spine's really supposed to work. And when you explain like, oh, it's supposed to be like a spring, okay, it's very easy to understand. But if you throw it out, it's a nail, and now it's just nailing down your spine and making it worse and worse and worse.
It nails it down, and you see they don't understand that within the vertebrae itself, there's different joints on either side of each vertebrae. I'm going to do this. So if this is a vertebrae, there's a joint right here and a joint right here on the side, and it connects with the vertebrae above it. And then down here, my pinkies are, they connect with the vertebrae below it. Those joints are called the facet joints. And when they works like a nail, that friction, that grinding wears away over time. It's not good. Chiropractic adjustments can give it some relief, but at the end of the day, they're going to need some serious lifestyle changes and postural changes. I do postural exercises here to build up the muscles that they need to build up to correct their posture, because they need both, and they need some lifestyle changes too. 100%.
Yeah. And I think that's one thing I really wanted to talk about, kind of what makes your practice different from others. We talked about like the posture and then the lifestyle intervention. So can you talk a little bit more about those two things?
So posture is huge. It's a huge part of the clinic that I work at. I do exercises on a vibrating platform, and I'll tell you why I do it on a vibrating platform, as opposed to most of my exercises are done on with vibration incorporated. Not all of them. The reason for it is I'm trying to do postural correction, and so your postural muscles are muscles you don't have to think about. So the way you sit, the way you stand, you default to how you are right now. You didn't think about it. Now the postural muscles get used to maintaining certain positions unconsciously through the autonomic nervous system. Okay, so when I adjust them, move, do my little hand movement for how I do that. But when I adjust, move things back in place, and patients are like, wow, that feels great. And then they go back to the computer, they go back to life. And the posture muscles within time say, hey, we've been living in a certain way for the last X amount of years in a certain position. We want to go back to that. That's what I'm fighting against. And these muscles are small muscles. They're not the big muscles that you can see when you work out, although they can work as posture muscles too. So what I do is I put them on a vibrating platform, because one thing that the posture muscles will do, okay, and that they all do, is they work not just to maintain your body in a certain position. So your body maintains a certain abnormal position depending on what you do all day. And if you're in an abnormal position most of the day, that's the position your body will start to have its default to. But the second thing that everybody's body will do is it'll maintain a position so that its eyes are parallel with the horizon. And that's just innate, okay? That's why when people have one too many beers, the nervous system's a little slower. The eyes can no longer adjust. The posture muscles work like a hydraulic system down from the bottom of your feet to the top of your neck right here. And they shift, they rotate, they bend, they flex. Your eyes stay parallel with the horizon. I'll give you an example. There's a beautiful, I'm by Puget Sound. People walk by the park right here, but you can imagine this, any park you want, beach park, whatever, forest trail, whatever. If you held a cell phone when you were walking with your family, your girlfriend, whoever, wife, whatever, and you replayed the video on the cell phone, and then you replayed the memory that you had of that walk, the memory that you have would be very linear, okay? But the cell phone, especially if you were jogging, the cell phone, the frame on the video would be very jumpy, very uneven. There's a reason for that, because the eyes maintain themselves parallel with the horizon, because the body's internal hydraulic system is your musculoskeletal system with your autonomic nervous system, adjusting, flexing, twisting, turning, bending as needed to keep the eyes parallel to the horizon. You don't even have to think about it. But the cell phone doesn't have that. Yeah. So that's why the visions are different. Okay. So when I back to the vibrating platform, the eyes are moving like shaking. So now I'm confusing the heck out of the posture muscles, and they get fatigued. Posture muscles can't react fast. Whatever I'm trying to build, whatever position I adjust them into, that adjustment and those exercises are going to be that much more effective and last that much longer. Have them do a vibrating platform exercise, and their posture muscles will just fatigue and tire out because they don't know what to do, and they'll just let me do it, get in a better position. But I think there's another part of it that I do with patients that's huge, and I think it's like, why is a chiropractor talking to me about this? You know, and with the diaphragm, and it's absolutely huge. There's two very important muscles in your body that you can live without for the most part. Obviously, the heart, one of them is your diaphragm. So your diaphragm is the main mover for your, and it is built just like your muscles built to pump blood to your last heartbeat to the day you die. Your diaphragm is meant to drop down, come back up, drop down, and come back up to your last breath. Babies belly breathe, diaphragmatically breathe. But as adults in America and pretty much westernized cultures, don't belly breathe. I remember listening to a video back in the 90s, and some guy was talking about that. I don't remember what it was. He said in Europe they belly breathe, but in America everybody's trying to have a six-pack and a flat tummy, so we all breathe like this, like that. That's how we breathe. I think it's healthy because the lungs are going way out, the stomach staying flat, the chest is going out. We're not supposed to breathe that way, right? So the lungs are pyramid shaped. They're smaller at the top, bigger at the bottom. And we're supposed to inflate the bottom first. And then if we need more air, the top will go inflate. There's a reason I talk about this with posture and a reason I talk about this with the spine, okay? Because the diaphragm's connected to the spine. It's connected to the lower lumbar spine on the vertebrae 1, 2, I think even 3. And it's connected to the lower ribs also. I can tell, and it's a core muscle. So when people think about core muscles, they think about the 6-pack abs, right? But they got to work on the diaphragm. I can tell when they're not diaphragmatically breathers when I touch their back, because typically vertebrae 1 and 2 doesn't move. Okay, and it's huge. And I'll get into the reason, but I have to tell you why. So they don't move because it's not being used every day. So when you diaphragmatically breathe every day, those vertebrae are flexing and contracting every day. So what happens? They get strong and mobile. And when they're not being used, and also because we're sitting down all day, they're getting weak and immobile, weak and stiff. And that's just a recipe for back pain and back injury. But I'll tell you more about how it deals with even posture. When we breathe like this from the upper chest, when we just have the upper chest go out, and we use these muscles right here, the scalene muscles, the pec minor, the upper traps, the chest. Now that skeletal muscle isn't meant to be used 24/7, yet we use it 24/7. So if you did this all day with no weight, yeah, you can do this, but can you do it all day? Your arm's going to tire out. That same skeletal muscle is a muscle right here and up here that we use for upper chest breathing. So how does this present in patients with pain, especially with neck pain? These muscles right here begin to fatigue and tire out. These muscles right up here that are used in breathing to help us breathe connect right here to the back of the head. It's now with that posture being like this and with these muscles tightening all day, wow, that's a recipe for disaster for patients that have a lot of neck pain. And so here's what I tell patients. Back in the days when we had to run for lions or chase gazelle to eat and to survive, it was okay to breathe from up here, but that's if you were a diaphragmatic breather to begin with. So you breathe from the belly, and then if you need that extra burst of air to keep running, then you breathe from the upper chest. And then here's the thing. That's a flight or fight response to breathe from your chest at that point, right? Because you're running from danger or you're running to fight, right? Most of our challenges that we deal day to day at work stress and with family or friends or traffic kind of story, we don't need a fight or flight response.
Yeah,
we don't. Here's the other beauty. Most of it's cognitive response that we need to be more effective in communication or with what we're dealing with at work. It's a cognitive response. When you belly breathe, you get more oxygen in, the vagus nerve kicks in, which is a nerve for relaxation. When you relax, your frontal lobe works, so you're actually thinking better, making better decisions. All right. And so how do we know if we're belly breathing or not? We put one hand on our chest, one hand on our stomach, and we take a deep breath in. I'm going to turn sideways for a second. And if your stomach goes out, that's a belly breath. My chest didn't have to rise up. I show patients this, and I have to teach them it. And so a lot of people can't do it because they haven't done it in years. They did it as babies. I guarantee you they did it as babies. When a baby cries, when a baby's born, it belly breathes. But it'll start to chest breathe when it's crying,
Yeah.
So we got to go back to that. So like I said, back in the 90s, it was an American thing. I think the whole Western, because I work kind of in the Seattle area also. So it's a very international community out over here, people from overseas. Everybody that's working, 24/7, always connected to cell phones and the internet, all this stuff. They're like here a lot. So interesting. As I started to tell patients about the benefit, because I think I shared the musculoskeletal benefit, right, to a degree with you. I mean, it gets deeper than that. I'll share one more thing about the musculoskeletal system if I can. People that get ribs that come out all the time, they're always chest breathers, majority of them. Serious, and they have anxiety often, not always. What does that have to do with belly breathing versus chest breathing? So these muscles are voluntary muscles. We start using them consciously to breathe when we should be using our diaphragm, which is a huge, big muscle. We should be using our diaphragm, not all these smaller ones put together. And when you're breathing from up here all the time, runners get this too, and I train runners. That's one of the things I also train runners, because diaphragmatic breathing it deals with life. So anything in life has a physical activity. If you're not diaphragmatically breathing, you can do it better if you do it with your diaphragm. It may feel odd in the beginning, but then when you get used to it, you realize, yeah, he's right. So science is right. So patients that get ribs that come out all the time, here's what happens. They're breathing from up here, using the chest muscles, using the intercostal muscles to do random chores. Get a coffee cup out of the cupboard, do some chores around the yard, whatever it may be. When you do that, without thinking about it, you're telling certain muscles on the right side of your chest or the left side of your chest to flex and contract so you can do those activities of daily living, mowing the lawn, lifting up a keyboard, whatever. At the same time you're doing that, if you're chest breathing, your nervous system is telling these muscles up here to flex and contract, and flex and relax, right? While at the same time, the nervous system is telling these other muscles to do something so you can do a physical activity with the upper body. Well, what happens if you get asynchronous neural firing? So in other words, the lungs telling your breathing technique is telling this one, hey, it needs to contract, but to lift up this object, or to breathe, it needs to relax, but to lift up an object, it needs to contract at the same time. Well, one rib's going to contract while the other one's relaxing, and now your ribs go out, right? So what I do is I talk to patients about diaphragmatic breathing so we can control these types of issues, so they can have less reoccurrence of rib pain. Because I find that patients with what they call slip ribs, it's painful, it's annoying, it's frequent, but you get that breathing under control, it's less frequent of an occurrence, less intense.
Okay.
It's pretty amazing stuff. But I'll tell you, the interesting thing, as I went down the benefits of diaphragmatic breathing, I realized, and I talked to other practitioners about this, nurses, doctors, other medical, people in the healthcare community, right? Not just chiropractors. So one thing I realized is, unless you're like a respiratory therapist, and even then, I don't know that they get into this. We don't really look at the diaphragmatic breathing in its entirety. So pretty much in healthcare, it's like, what do we look at? Pulse oximetry, end-tidal CO2. These terms and these things are monitored with monitors and devices because they're things we look at in life or death situations, but we don't look at them in everyday activities and how they affect us. I just shared musculoskeletal stuff, but if you breathe like this, if you have digestive issues, it's going to improve. Why? Because the diaphragm is this huge muscle. It'll drop, it'll compress against the organs, and it'll help activate the vagus nerve and massage the organs of digestion, the colon, the small intestines, and it's going to help push the food out. The vagus nerve responsible for digestion will get massaged because that nerve runs all over like a spider web, just all over the place down to the neuroenteric system. The Chinese used to call it the second brain, but we get that activated and the food will start moving the way it's supposed to. We got patients with, they have issues with, they have issues with the lymphatic system, right? So what is the lymphatic system? I'll show you how it relates to diaphragmatic breathing, right? The lymph system works to, we got cancers, we got all these diseases out there that are breaking out. And the lymph system, it relies on musculoskeletal system to move. Okay, the blood vessels use the heart, but the lymph system to fight off infection. You got all these autoimmune disorders, right? Notice a lot of people's autoimmune disorders. I'm not saying this is the only reason, the key reason, but I'm saying it's a component we need to look at to holistically address our patients' health, okay? Because there's so many factors that go into our diet and our food and things that are going on in our society right now. But when you look at patients that have like these autoimmune disorders, and the lymphatic system is a system that's designed to get rid of excess water. Obesity is a problem, weight is a problem in the country, and get rid of excess waste and abnormal cells. Abnormal cells, well, that's going to lead to cancer and other issues, right? The lymphatic system, I think, can even take care of parasites to some degree. But here's the thing: outside of the spleen, the biggest lymph node that we can have is right under here under the diaphragm. I think it's called the cisterna chyli, if I'm not mistaken. The biggest one. Well, you got lymph systems in your arms and your neck and your legs. When you walk, when you do your chores, you move your neck left and right, these things are getting pumped. How's this thing going to get pumped unless you're doing a gazillion sit-ups a day when it's located right here by your diaphragm? That's your biggest one. That's like the causeway. That's like traffic central for your, outside of the spleen, that's like traffic central for the lymphatic system, right by the abdominal aorta. Well, you got to diaphragmatically breathe. You got to pump that out. You got to start getting rid of all that abnormal waste inside your body.
Now, I know you've gone over quite a bit of the benefits of it, so I'm sure you must have some great stories as far as like people that have come in, maybe were running into a lot of issues, but then after going through all this, they just had an amazing turnaround. Do you mind sharing some of those stories that patients you've had like that?
I do. So I had a patient, so I deal with a lot of car accident patients at all the clinics I work at. I have my own clinic, but I also work for other areas in the county and up north in King County as well. I had patients that I noticed weren't getting better when clinically they're supposed to, because like a sprain strain, hey, you're supposed to get better in about 3 or 4 months, typically, not always, but typically, right? Yeah. And they were just recovering really slowly. So I do it still to this day. And I had a doctor when I was an intern asked me to do it. So I looked at the breathing, and I'll tell you, I did something else. That's what we can talk about, maybe hypnotherapy. But I looked at the breathing, and I'll tell you why. So I talked to these patients, and I realized these guys are not getting better. And these guys were typically people that were drivers, like they had to drive full time. So when you drive in the Seattle area, when it rains all the time and crazy drivers on the road, these guys were like reliving that PTSD trauma of the accident on the daily. So when you drive and you have whiplash, it hurts to look left and right. Can you imagine having to do that 8 hours a day to avoid an accident? You're just in an accident while you're trying to rehab, that hurts. But when you have anxiety, that makes it hurt even more. We talked about the muscles of the neck right here in terms of diaphragmatic breathing. So I would teach them about diaphragmatic breathing exercises to get them to relax. Now, here's the other part of diaphragmatic breathing, and this is from the VA. I didn't want to go too far, but I'll let you know. The VA actually teaches diaphragmatic breathing. So I was talking about the benefit for the musculoskeletal system, but the VA teaches it to help us calm down. We talked about diaphragmatically breathing, activating the frontal cortex of the brain that deals with reason and rationale, fight or flight, activates the amygdala system, it deals with flight or fight. But this acts as a more cognitive issue right here, more relaxed center. So I'd have them diaphragmatically breathe to calm them down. But here's the beauty of it. The VA will actually give you meds, and they'll give you a choice nowadays. They'll give you meds to calm you down for panic attacks. They'll tell you, if you have the right provider, and they'll tell you, hey, these meds take 30 minutes to kick in, or you can learn belly breathing, and it'll kick in 5 to 15. Which do you want to take?
Yeah.
I want to believe the VA did it because we're thinking holistically, but part of me wonders if it was just to save money on prescription medication, right?
Yeah.
I don't know. I like to think it's a trap. But here's what they don't. Here's something else I want to share about diaphragmatic breathing, and is 80% of our serotonin is built, like we said, the Chinese called it the second brain. 80% of our serotonin is built in the neuroenteric system down in our gut, in our intestines. Only 20% is our brain. So when it comes to anxiety or anything like that, if we just breathe in, we create that pressure right here in our gut. We create that pressure and help extrude the good nutrients and those good hormones out into the bloodstream. Wow. I'll tell you, a lot of my patients that do have issues with like mental health, they aren't belly breathers. And I'm thinking, okay. And then a lot of them have anxiety after an accident, car accident, especially when they're full-time drivers.
Yeah.
Not even giving 80% of your serotonin hormone to help you feel good and relax. You're not even giving it a chance to go in your bloodstream yet. So let's address that. And it calms them down. But after I tell them those extras, it worked. You know, I mean, I will tell my patients, hey, when you see them, once you notice it, like what it looks like on their face, PTSD from a car accident, I can tell right away. I'll be like, every bad dreams, I'll let them know that's going to go away. Just the suggestion to put it in there. That seems to be pretty effective. And I tell them about the breathing, and then I tell them why the breathing works to help with that. And so, one of my patients, I was teaching her breathing techniques for her spine and posture. And I told her some of the benefits that we covered. And she stopped me and she goes, somebody told me this already. She's actually a teacher. And I said, what's her name? Ended up being one of my patients who's a teacher who ended up teaching these techniques to kids in her class. And the mom was there during when the class was getting taught. Kind of like that paying it forward. I don't know, man, but that was one of the biggest success stories in my mind.
That's awesome. That's great. I think that's like the best testimony to your skills, is that when someone that you've done it for has helped them and now they're spreading the word about it. I think that's just fantastic. And that just kind of brings me to my next question I want to ask you. I'm sure a lot of people have these misconceptions about what chiropractic care is. And some people may have that confusion of, well, what's the difference between chiropractic care, especially with the type of stuff that you're talking about, the posture, the breathing technique, versus something that's like physical therapy? What is like the biggest difference between those two? So
I'll get to the history of chiropractic, because you got to understand it's evolved and where it's gone. Okay. So when chiropractic first started, there were the drugless physicians, and it's actually been around longer than we claim it has been. Traditional bone setting has been in Europe forever, been in Mesoamerica, Latin America, Africa, Asia. It's been there forever. It was in China under Queen Ah, the bone adjustments that they would do. It's been around forever. Back in the 80s, or back in the relatively recently, we lost our classification as alternative medicine. And the reason I bring it up is under the classification of alternative medicine, chiropractic was able to do all these different modalities, and some of them weren't necessarily scientific modalities. Okay. So but now within true chiropractic, licensed chiropractic, the way it's supposed to be in the States, we're really the drugless physicians. And there's a little bit of legal waiver on that in some of the states as they've moved it forward down in New Mexico and I think Oregon. That legislation was stopped for better or worse by the chiropractic community. That was introduced because of the lack of providers in those areas. But what we do is we're basically the drugless physician right now. And if you want to get better and treat it through manual therapies and through diet, lifestyle, nutrition, a chiropractor is a good way to go, 100%, especially for musculoskeletal systems. There are some chiropractors that work in functional medicine, right? Getting blood labs and then telling you what diet would work for you and so on. But what they haven't done in the chiropractic community, as well as they've done in the medical communities, medical community has really defined their specialists. So when you see a plastic surgeon, that's a plastic surgeon. When you see a pediatrician, that's a pediatrician. You see it, etc. So the chiropractic community is just now, over the last 20 years, they're starting to do that more through their postgraduate diplomate programs, right? Where chiropractors become more specialists in certain areas. But you won't really know what his specialist is, or specialty specialty is until you actually meet them or talk to him or her prior to going to their office. Otherwise, you'll find out once you're there. But that's what we are. We practice physical therapy, exercises. We do adjustments. We do nutrition and consulting, and that's who we are. And I love being a chiropractor. It's been a very rewarding career, getting patients to get better, be better, live better, for sure.
Yeah, a much more holistic view, and I think that's really the way that people are going. They want to go the drugless route. They don't want to have to worry about surgery and taking drugs the rest of your life. So this is a great alternative for them, so they don't have to go through all that and suffer through all that.
Absolutely. Sometimes you need surgery. I refer my patients to surgery. I have a guy that he was in a car accident, but he has a ganglion. He has a cyst in his spine, and I asked him, "Are you getting better with the adjustments?" Yeah. So he keeps coming back every week. But what I'm really waiting on is a surgical consult that's supposed to be. So we can get that removed, and then we can see how he is. But for the areas that it can make better, it can make a huge difference. It shouldn't be the last stop. It should be the first stop people make, and often, not always, but it should be the first stop people make with injuries. I had an injury, like I said, in the Army. Yeah. They gave me 2 choices right off the bat. Well, they gave me 3, but the first 2 were surgery or drug. And they go, if you don't want that, we'll give you PT. I'm like, I'm going to go see a chiropractor. Yeah. And like I said, and it's been a great experience ever since. So, and that really fixed me. Some people don't get those options, or they don't explore them. And I think that's a shame. I have a friend of mine that sent me his x-rays. He's had years of neck pain. It's actually a relative of mine that lives out of state. He has years of neck pain. Never saw a chiropractor that I know. And I saw his x-rays, and I'm like, I can help you. Well, if you lived up here, you can see a chiropractor to help you get better, but you need surgery. So all they're going to do is make it better, help with a better surgical outcome. But at this point, you pretty much need surgery. But for the majority of us, let's just stay healthy. Let's stay well, Let's find those. And the beauty of it, you don't have to be sick to see a chiropractor. You don't have to. You don't have to need a root canal to go see a dentist, right? Just go see one before you need a root canal. Just get your adjustment, Yeah.
I think that's a great message to share. Now, Dr. Ivan, I have one last question for you, but before I ask it, I want to point people to your website at www.back2life.today. Now, the last question is, what would be the most important piece of advice you can give to someone who is suffering from some type of pain, but maybe has some type of reservation about going to go see a chiropractor?
Oh, that's an interesting question. So I put it to you this way, and I'll let the stats and the numbers speak for themselves, right? I have a $3 million policy, malpractice policy, okay? I have it because I have to have that for Medicare. And insurance companies, especially when it comes to the auto industry, right? If you drive a car and pay auto insurance, but you know, if you're a bad driver, they charge you higher rates. If you have fire insurance for your house and there's a lot of fires in your neighborhood, it's up there, right? Medical malpractice insurance is no different. So a lot of other practitioners that provide either medicine or surgeries, right? If you're in that field, you're for a $3 million policy, a lot of medical practitioners, and I don't want to, this isn't a ding on the medical doctor industry at all. I love those guys. My partners I refer all the time, but they will tell you for a $3 million policy, a lot of them are paying $50,000 a year. Some are paying twice that. Some are paying even more than that, right? Guess what I pay for a $3 million policy? I pay $2,000 a year. And I want to, and it's not because Dr. Ivan Sanchez is just awesome, right? It's just the industry itself is pretty safe. It's pretty safe, right? If the doctor does a proper screening, it's a pretty safe outcome for most patients. Absolutely, 100%.
Okay, I love it. Love it. Well, there you have it. Dr. Ivan sharing his expertise. Dr. Ivan, where can people contact you in your practice?
So I'm in Steilacoom, Washington, the greater Tacoma area of Washington. I have a website, backtolife.today, and I share space with other providers. So you click on it, you want to schedule, it'll give you another C-SPA biz address to schedule. So don't be dismayed if you see that. Just look for the chiropractic part. Okay. But I appreciate my time with you all. And if I could leave one message, I hope you all breathe well and move well, and best of health to you all. Thank you.
Perfect. Great. Thanks for being on the show and sharing your message with the world.
Thanks, Daniel. Great talking to you.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.